Welcome to the Alex Salmond Show, where we examine one of the consequences of all 4 UK administrations allowing COVID to sweep through the population. Although cases have been surging through the late summer, the 4 home nations have taken comfort in the fact that mass vaccination has weakened the link between infection and hospitalisation. Thus, although cases have been reaching near record levels, the pressure on the health service from the contagion is much less than it was in previous waves of the virus. However, while the vaccines appear to be limiting the acute impact of the condition, there is still great uncertainty about the long-term effects and in particular about the condition dubbed long COVID. On today's show, we'll look at the science and the personal impact of this debilitating illness. Professor Danny Altmann of the Department of Immunology, Imperial College London, is among the foremost specialists studying this issue. Nathalie McDermott is a clinical doctor subspecialising in paediatric infectious diseases in NHS. She is also one of the now estimated 1 million people suffering from long COVID.
The administration had no mandate, no political mandate.
First, though, to your tweets, emails and messages in response to our show last week on the Forever Wars, when Alex interviewed Colonel Lawrence Wilkerson, the former Chief of Staff to US Secretary of State General Colin Powell. And that show has already clocked up over 725,000 views on Facebook alone. Ian Henderson says, knowledgeable, experienced and deeply relevant. Thanks. Lauren Hutchison agrees. Good interview, she says. Very informative. William says, this is the very best yet. Pity the rest of the media weren't this open. Thank you all at the Alex Salmond Show. Corey Oak says, great insight into the region's troubled past and future in the long geopolitical dance. Jim Wallace says the forever wars will continue, simply because the people that hold the power are those who manufacture weapons and ammunition. No more wars mean an end to their profits. Hugh Fraser says, it's so refreshing to have an intelligent interviewer asking intelligent and poignant questions, then actually listening to the answers from the interviewee. Hasibul Hassan says, sending troops to Afghanistan was one of the biggest mistakes the United States has made. Brian Bolton says, the war is only just beginning. Biden's incompetence has made the Taliban the most well-armed terrorists in history. Felix says, that discussion should be watched by millions. Best one yet. Keep them coming. To which Stephen Wright agrees and says, glued to that one. Great interview with top guest. And finally, Robin Dewar says, they were never a weapon of deterrent, but one of mass destruction. It's totally delusional to think otherwise.
Post-COVID-19 syndrome, or long COVID, is still one of the underreported stories of the pandemic. In the first year, attention was understandably focused on the dramatic acute cases of COVID crowding out the emergency care wards. However, it is gradually becoming understood that long-term debilitation from the aftermath of the disease may be as socially and economically significant as the immediate pandemic. Alex interviews a leading academic in the field, Professor Danny Altmann of Imperial College.
Professor Danny Altmann, thank you so much for joining me on the Alex Salmond Show.
Pleasure.
Now, this is still a relatively new condition because COVID obviously is a new disease. How did the idea of long COVID get first identified?
Well, the route to long COVID has been a bit unusual, because this is a disease that's been identified not through the textbooks or the lectures, but through social media. It's a disease of the social media age, or let's say a definition of the social media age, in the sense that during those months after the first wave of COVID, there were sufferers all around the world, initially especially from Europe, from Italy, describing this condition, and they were the ones who've named it, who've got the symptoms all listed down there.
And that, of course, will have certain advantages as well as being unusual, because that means lots of people will be talking to each other about the variety of symptoms. So each physician won't just be studying a single group of people. In effect, will have access to information from a large group of people.
Yeah, I'm a big fan of the approach. This is a condition that's been defined and defined itself, very visibly through the patients. The naysayers and the cynics say, well, it's self-reported, but how could it not be self-reported when we have no other way yet of reporting it? It's very real and a very good way of doing it.
And of course, long COVID will summarise a range of conditions of severity. I mean, some people totally debilitated over an extended period of time, some people just having periodic bouts of weakness. Is there a full range of the severity of symptoms?
Yeah, I think we've got to work very hard, like any other clinical definition, to have a very clear working definition that any GP can tick the box for, so they know exactly what we're talking about. And that is difficult when you've got 200 plus symptoms that are included under that list. But I think all of us working in it now have a sense of what it looks like and what this thing is.
And bearing in mind that this is still a new condition, are the vaccines offering hope for long COVID sufferers? I mean, the vaccine prevent people developing COVID. They reduce the severity of the immediate symptoms for many people. Do they offer hope for long COVID sufferers?
Well, only indirectly, in the sense that long COVID can ensue from any active infection with this virus. It doesn't matter whether you were asymptomatic or in intensive care, you're at risk of having long COVID. The vaccines are really good and reduce your risk of getting infected in the first place. Therefore, they also reduce your risk of long COVID. No more, no less than that.
And is there a possibility that a therapy might be discovered, therefore, that would effectively chase the virus out of the system? Or when people go down with long COVID, are they effectively beyond that aspect?
Well, so much research at the moment, all underway, at looking at every possible aspect. So sure, if you could pin it down early, work out what it is and where it comes from, you could perhaps treat people early with antivirals or anti-inflammatories. Or if you just had a better working definition of what this thing is, there'd be so many therapeutics, I'm sure, that you could apply.
Now, many of your colleagues in intensive care have made the point to me that COVID is unusual in the sense it's a virus which seems to attack the weakest point of the body almost. It's not purely a bronchial condition, but can attack the liver, the spleen, any other organ. Long COVID symptoms, do they have the same range of symptoms as the immediate acute condition?
Yeah, great point. So when we talk about the sheer audaciousness of this horrible virus, as you say, one of the things it does is it binds to this receptor ACE2 that's all over the body, and that has impacts in your brain, your kidney, your liver, your lungs, your gut, your blood vessels. And to some extent, one could argue that's mirrored in the long COVID symptoms. Or you could just say, well, if long COVID is immunological, your immune system is all over your body. So, so why shouldn't you have problems everywhere?
And is long COVID, from your studies, is it a disease with an active virus still attacking the body, or is it the symptoms of previous attacks and the body attempting to recover from the infection?
Yeah, important question. So the jury is still slightly out on which of the mechanisms we think are most likely for long COVID. Some people like the idea that it's a reservoir of persistent virus, perhaps in the gut. And there's some good evidence to support that. Folks like ourselves also like the idea that it's kind of perturbation of normal immunity, that your immune system takes months or years to get back to normal.
And what's your estimate on the number of people across the country now who could be classified as long COVID sufferers?
Yeah, so we bicker a lot about this because we don't have a hard definition. And even the ONS data versus the REACT data, depending on whether you say persistent, is more than 4 weeks after your acute attack or more than 8 weeks after your acute attack, or the real long haulers who are still desperate a year later. So when I have to guesstimate, I say a minimum of 1 million people in the UK.
And with that scale of condition, are you being consulted by government departments as to how these definitions can go into social security policy, for example? I mean, what's been done to deal with an infection in that mass scale?
Well, I wouldn't sort of big up my role in it. I get asked to consult on lots of different things, including long COVID. But I really want to see more and more consultation on this, because we so can't stick our heads in the sand, because this will have implications for healthcare planning, for medical school numbers, for employment law, you name it. This is going to haunt us for years to come.
And what would your advice be to someone who believes of taking COVID, believes they're suffering from prolonged symptoms? Obviously consult their own physician, of course, but should they be going onto the internet, joining the societies? Should they be comparing notes with other people? Is that a therapy in itself?
I think it's more than a therapy. I think the patient groups have been dynamite. They really have led the race. And you know, some doctors are good and some are less good, and you need to be able to walk into that GP surgery and state your case very clearly. And I think the support groups can help you to do that.
Professor Altmann, in terms of the range of symptoms you've seen reported, obviously fatigue would be very much a common factor. Are there other things that people should be looking for in particular? We know that the acute condition has certain characteristics like loss of smell. Does long COVID also have certain common factors that are afflicting many people?
It does. I mean, there have been so many good studies on this now, mainly out of the support groups, where the list now stretches to something like 200. So I think commonly near the top of the list are, you know, your fatigue, brain fog, neurocognitive, wheezing and breathlessness, chest pain, loss of taste, and probably hair loss, and then you get onto the slightly rarer ones. But those are super common all around the world.
And speaking around the world, how much of an international effort is being focused on tackling the long COVID?
I think it really is important to have an international effort, and that is growing. And there are meetings, for example, World Health Organization are looking at it. NIH in the United States draw together different groups from different countries. And it's important, I think, that a person anywhere in the world feels they have the same rights to walk into their doctor's surgery and say, you know, I've been out of action for the last 6 months, help me to talk to my employer, help me to get some answers, help me to get some treatment. And that those can't be local answers, those need to be global answers. And I think we're trying hard to build those.
Is there still an aspect of which long COVID is at the back of the queue while people deal with the acute condition?
Yeah, so we've been through, 19 or 20 months now of firefighting and looking at daily fatalities and little tolerance to look at anything else. But all I say, you know, when I get a chance to speak to policymakers about this is, you know, we can't duck this. When I look, for example, at Brazil and their experience with chikungunya virus, long after you've stopped worrying about the acute infection, you have to worry about those 3 or 4 or 5 years of aftermath of people flooding your clinics, desperate for help, out of work, loss of income. You know, so whether you like it or not, it's all there to haunt you for years to come.
So taking that opportunity, speaking to the health ministers and secretaries in the 4 administrations of the UK, what message would you have to them about what's coming in terms of the long COVID pandemic?
Oh, you know, let's do the crystal ball gazing, let's do the planning, let's do the financial planning, let's do the healthcare planning, let's do the manpower planning, because it is knowable and it is going to be here to bite us if we don't address it.
So, bearing in mind that it's a new condition, these prolonged symptoms of this deadly, pernicious virus, but in terms of your medical expertise and the range of it, Professor Altmann, does this remind you of any other virus in terms of the way it's attacking people over a prolonged period?
Well, the simple answer is, like everything else with COVID, we didn't see it coming. I didn't see it coming. We thought coronaviruses didn't do things like this. But when I think back to other things I've worked on in the past, I think of things like glandular fever, the way that can come in and take teenagers especially and really lay them low for a prolonged period. I think about work we do in Brazil on chikungunya virus that you get from mosquitoes, where long after people have forgotten the acute infection, they can't go to work because they've got a kind of autoimmune arthritis for years afterwards. So there are plenty of models out there that we can look at and try and understand perhaps what's going on.
Professor Danny Altmann of Imperial College London, thank you so much for joining me on the Alex Salmond Show.
Pleasure.
Coming up after the break, Alex continues discussions on the impact of long COVID. We'll see you then. Welcome back. The early weeks of the pandemic were busy for Nathalie McDermott, specialising in paediatric infectious diseases and with experience in medical response to disasters and epidemics. Her expertise was in great media demand. Then she contracted COVID herself. Alex takes up the story with Dr. McDermott.
Dr. McDermott, thank you once again for joining me on the Alex Salmond Show.
Oh, it's my pleasure. Thank you.
Now, let's go back to the start of the pandemic. I mean, there you are, very much in demand by the media because of your expertise in infectious diseases. And then suddenly, from being somebody explaining the pandemic to the public, you became a sufferer yourself. What exactly happened at that time at the start of the pandemic?
So at the start of the pandemic, or at least around March time, I returned to clinical work. And while working at one of the hospitals in London, I contracted COVID-19. I was only unwell it was probably about 4 weeks to fully get back to normal, but I was back at work after about 10 days. And then I was back working. And then again, whilst working on a COVID ward in about May time, I became unwell with an almost identical illness again to COVID, which seemed a very quick time to become unwell again. But I became unwell and had a very similar illness for about a couple of weeks. But during that time, I also developed some nerve pain in my feet and loss of sensation in my feet. And things have kind of gradually progressed from there to now where I'm quite limited in my ability to walk. I walk with crutches, and I have some issues with my bladder, and we're still trying to get to the bottom of exactly what has happened.
So that's striking you with your medical expertise. You must have sensed quite quickly that this is strange. I mean, this is something I should have recovered from, and it's not the same as getting another bout of COVID. So with your medical expertise and background, you must have realised fairly early that there's something very, very different going on here.
Yeah, I think initially I had a lot of pain in my feet during that first 2 weeks where I had the COVID-like illness. So I just thought it was part of that. I had a lot of muscle aches and pains, so I thought it was part of that. And then all of the other symptoms resolved, but the pain in my feet didn't. And I think that's when I started to realise that it resembled nerve pain in my feet. And I spoke with my doctor and got some medication. But, you can get situations like that following viruses that are relatively transient and then sort of resolve. So I think I just hoped at the time that it would gradually get better. But then I realised when I was trying to drive my car one day to get to the pharmacy to get my prescription that actually I couldn't feel the pedals properly with my feet. And then I started to realise that actually my legs weren't as strong as they were. And I kind of hoped that, obviously I'd been unwell, so it takes time. And hopefully over a couple of weeks, I would build up that strength in my legs again. But I just never did. Despite going for walks every single day, I never managed to build that strength up again. And then things seemed to kind of gradually get worse in stages. So in September time, I had quite a significant deterioration. And that's when I became very limited in how far I could walk. And then gradually over time, I got the crutches and I could walk a bit further using crutches, but not without them. And then I think in January time, I had another setback, some issues with my bladder and so on. So that kind of, so it kind of continued to progress from there. So,
well, of course, your own medical experience included working on epidemics in the African continent, a range of viruses and diseases. Had you recognised anything quite like this in other viral conditions?
I think probably not identical. Certainly with Ebola, we know that there is what's referred to by some as a post-Ebola syndrome, and people can have sort of ongoing sequelae. But with Ebola, it tends to be very specific, largely speaking, focused on the eyes. So people get a lot of inflammation in the eyes, and if that's not treated properly, they can go blind. But we also see that people have joint pain, and they also have tiredness and headaches and so on. So there are some features that overlap, but I think we probably didn't see it on quite the level that we have seen people developing problems following COVID, and probably not with quite the variety of symptoms that people have following COVID. With Ebola, it was quite limited to sort of mainly 5 specific symptoms or syndromes in terms of which organ system was affected.
Now, long COVID's a very unusual, a new condition, obviously, but one unusual in the sense it was actually named by the social media. Were you part of these early social media groups who were comparing experience, who actually named the condition and brought it to public awareness?
So I think it had been probably named shortly before I was really involved with some of the social media groups. I think I started to get involved in around the end of July, beginning of August time, when things still weren't improving in my condition. You know, I'd kind of anticipated a few weeks of recovery and things still weren't any better. So I guess I joined a bit later. So it had already been named, but certainly I was part of some of the doctors' groups that were discussing the symptoms and discussing what was going on, and realizing just how many people might be affected by this condition.
So with much of the medical profession understandably caught up in the acute phase of the pandemic, and a lot of the media concentration on the intensive care wards and whether the National Health Service would be overwhelmed in an acute sense, I think that the social media was an outlet, at least, for getting some concentration on this enduring phase of the disease and communicating with fellow sufferers.
Yes, certainly. And I think it's provided a lot of support to people during that time, especially when they couldn't access any kind of healthcare or any kind of, really attention from their doctors. So I think it certainly provided a support network. I know it's received criticism because people believe that it fuels people believing that there's a problem, even if they don't potentially have one, but I would disagree. I think it's been an extremely good support network for people, many of whom are still struggling, even 18 months into the pandemic, to actually get the kind of healthcare attention that they need and that they deserve. So I think it's been useful in that sense, but also it's been particularly useful in raising awareness of the situation. It wasn't really until the autumn of last year that I would say the UK government and people seemed to really catch on board about the significance of long COVID and the number of people affected, and people affected for a very prolonged period of time.
So what do you think needs to be done now in terms of an official response to long COVID, given the number of people who are clearly being afflicted with the condition?
I think it is being taken seriously now by the UK government, but I think that there's still not the level of seriousness being taken by the medical community actually towards it sometimes in terms of treating people. There's a core group of clinicians who are doing very well at caring for patients and raising awareness about the situation. But equally, there's some naysayers who dismiss it and simply think that it's just some level of fatigue and that people will get better and it's not really that big a deal. And I think that people need to take on board that it is. And I have to say, when it comes to children, I think there is still a degree of dismissal about it affecting children and young people. And actually, I think we need to be taking it more seriously, because whilst proportionally it might not affect as many young people as it does adults, it's still affecting a significant group of young people and some older children. And we need to factor that in. And I'm not entirely convinced it's being factored into our decision making about the vaccine either. Certainly from the documents I've read from the JCVI, whilst they comment on it, there's sort of a sentence about it that says, well, long COVID we've had people raise concerns about long COVID, but it doesn't really seem to be something that's affecting children that much. And I think that if we're going to take into effect the side effects of vaccines and the risks of them, which are actually extremely rare, why are we then not taking into account that people or children with COVID might go on to have long COVID, even if that's only 4 to 8% of them? That's vastly higher than the risk of the side effect from the vaccine. So I just wonder why we're not taking it as seriously as we should yet.
And finally, if I may, Dr. McDermott, in terms of your own condition, your own experience, are you detecting some light at the end of the tunnel? Is progress being made?
I would say, sadly not. I think I'm learning to live with my limitations a little bit better, but I don't think that there's really been any significant progress in terms of my neurological condition. And I continue to occasionally develop new symptoms related to that as well, which obviously is a little bit concerning. But hopefully we are making some progress to where the problem is. I had some investigations recently which have suggested there is a problem at the very base of my spinal cord. So hopefully might get some more imaging soon and identify what's really going on.
Dr. Nathalie McDermott, you have our very best wishes, and thank you once again for joining me in the Alex Salmond Show.
No, thank you very much.
The focus on acute illness in phase 1 of the pandemic is understandable. St Thomas's Hospital behind me is where the Prime Minister himself was treated. Loved ones dying, intensive care wards full, the health service buckling under the pressure. This is what has dictated the focus on acute care. That is the human cost of the pandemic. However, it is increasingly apparent that in social and economic terms, the threat of long COVID is even greater. On a conservative estimate, 10 times as many people will suffer debilitating effects of long-term COVID as have died from the first stage of the pandemic. This leads to serious questions on the policy of the 4 administrations of the UK. If long COVID is a comparable threat to the acute stage of the pandemic, then why are they allowing the high levels of disease to sweep through the population? In all 4 countries, public health prevention measures have been relaxed to the point of non-existence. The health service may not be overwhelmed in the short term thanks to the impact of vaccines, but in terms of human misery, they may be piling up huge problems for the future. The cost of Freedom Day may be very high indeed. But for now, from Alex, myself and all at the show, it's goodbye, stay safe, and we hope to see you all again next week.